They've leveled off.
Sure. So I'm going to kick off today. I'll only take a couple of minutes, and I want to welcome you all to this event that's hosted by Allstate Northern Ireland. I'm a director at Allstate, and I just want to give you a little bit of context of who we are. Allstate is in the US, and it's one of the largest insurance companies for auto and home. And here at Northern Ireland, we primarily deliver technology solutions that we both build and support. There's around 2,300 of us all across Northern Ireland, and we're based all across Northern Ireland. We do have offices in Belfast. I'm here in the Belfast office today, and we have offices in Strabane and Derry. Of course, the majority of us are still working from home, and I think some of the guys here from Allstate are working from home as well. So at Allstate Northern Ireland, even though our day job is working in technology and delivering solutions for our parent company over in the States, we take our role in our community very seriously. So much so, we have a Force for Good group that invests in our local community, in our people and in our environment. And we even give our people volunteer hours annually to use as they wish. This particular committee that has brought this group and this talk together is called Anybody, and it's very close to my heart as I was one of the co-founders back in 2013. And back then, when we kicked it off, we focused on bringing in suicide awareness internally to our team managers. So fast forward to today, through the tenacity of a very small group of people, and full disclosure, not me. There's people in behind the scenes that are bringing this together. It has evolved to today where we're focused on school teachers, you, and the young people. The team that have brought this event to life today have been going for 9 years, and their mission is just as relevant today as it was back then. So I just want to thank Elaine, Paul, Caroline, and Phil, and all the other people within that committee to bring this to life. As I said before, it's not their day job. They're passionate about this subject and work really hard to bring these events to life for you. Their drive and commitment and passion is infectious, and I'm really proud that you have kept it going over all of these years. You are making an impact, so thank you. So with that, I am going to hand it over to the main talkers, the people who you have signed up and dialed in for, and hand it over to them. Thank you.
Thank you, Susie. My name is Philip Snoddy. I'm one of the ANI body committee members here. We're very lucky. We work for Allstate, and I suppose I'm going to fly the flag here and say they're very supportive of all the colleagues and staff. And Susie's very supportive whenever we need to get some funding for events like this. We're able to put them on twice a year. We're really in this community outreach part where we're trying to help teachers, and we're also trying to help the pupils as well. Earlier in the year, we had the Samaritans talk of what they could provide for our schools. So that was good. We're not getting much out of it. We're just it's good for us. We feel good, and we're helping you guys network and find out resources. We're all very passionate within Allstate ourselves. We are mental health first aiders as well. So Allstate likes to protect its staff and colleagues, and these resources became very evident during the lockdown. We didn't need the physical first aiders. The mental health first aiders were very engaged, shall we say. Look, today we have just a couple of wee ground rules. If everybody on the call can please keep muted, and that'll allow the speakers to get their message across. If you have any questions, could you just pop them into the chat, and we'll monitor the chat. One of our colleagues is there, and at particular breaks, we'll just bring some of those questions to the fore. It's obviously being recorded today, and after we do record it, if you still have some questions that you would prefer to have on a personal level or whatever, and didn't want to really share them with the recording, that'll be the time to do that. We'll stay on for maybe half an hour afterwards to field some of those. Previously, in the years prior to pre-COVID, my goodness, I mean, we talk about things like that now. There's now a phrase that would always be not prehistoric, but pre-COVID. We used to have you on site and give you goodie bags. now we can't really, that's not practical to fire that out. So we do have a wee prize draw for those people that attend at the end. And Paul's going to look after that, depending on if your name comes up in the Zoom list. Okay. So there's a couple of wee prizes, I think 40, 60 and £100 vouchers to be spent locally. We have two speakers today. So we've got Julie and Hilary, and they're going to give us some of the insights as to what they provide and some of the theories behind protocols and such like for teaching staff that they can utilise. So without much further ado, I suppose I would like to introduce Julie Plackitt from the Department of Education. Now, let's all be easy on her because she was only being put in post on Monday and has sort of taken over the relay baton, as I say, for this here one. So the talk should be on emotional health and wellbeing framework. So Julie, are you good to go?
Yeah. I am indeed. Thanks very much, Phil and Susie, for the introductions. Yeah, I have started this post, as Phil says, just this week. That's not to say I don't have background in these areas. I've worked in the department for a long time and worked in the overall Children and Young People's Directorate for quite a long time, with some time spent in special educational needs, then additional educational needs, and now pupil support. So what I'm going to do is share my screen with you, hopefully, so that I can do this presentation on the emotional health and wellbeing. Just bear with me. And we should play. Okay, so hopefully everybody can see that. And as we've already confirmed now, my name is Julie Plackitt from the pupil support team. I'm the interim head of team in the Department of Education down here in Bangor in Rathgale House. So yeah, the topic that we're covering here this morning, or this afternoon, sorry, is the emotional health and wellbeing in schools framework. And it in itself was launched in February 2021. So the challenge for us before initiating that was being aware, as I'm sure you all are, of the number of young people in Northern Ireland, which is 25% that are more likely to, sorry, I need to just move something on my screen here, apologies. I need to go back. And hopefully that's okay. So apologies for that. So yes, young people in Northern Ireland are 25% more likely to experience common mental health problems such as depression and anxiety compared to young people in England, Scotland and Wales. In addition, we have a persistently high suicide rate, which includes disproportionately high rates among young people. When we consider that 50% of mental health problems are established at the age of 14, the importance of promoting emotional health and wellbeing at an earlier stage is clear. So the wellbeing in education requirement, then it's a high priority, obviously, for the Department of Education, which has been further heightened by the challenges arising from the pandemic. Educational settings, as you will all be aware, play a central role in promoting wellbeing for both pupils and staff and can act as a refuge for vulnerable children. So our response to the challenge was to develop in conjunction with partners, including the Department of Health, the Emotional Health and Wellbeing in Education framework. And hopefully most of you will be aware of that and will have seen that when it did launch in February 2021. There's a link there to it, and I think we will be sharing the slides for participants. So if anybody does want to read it again or hasn't seen it before, the link is provided there. So what is the framework for? The overriding aims of the education framework are to ensure that children and young people are empowered and assisted to understand and take care and manage their emotional health and well-being. to identify needs early and to address these effectively as required. To have an integrated model supporting prevention and early intervention, and to ultimately then have fewer numbers of pupils requiring specialist intervention. And it's important to note that this is not about reducing services that are needed. It's about catching things early and preventing them where possible from escalating to that crisis point of needing that specialist intervention. So who is the framework for? The framework has been written for those working with children and young people in education settings to assist in not only recognising the emotional health and wellbeing needs of their pupils, but also in themselves, and to avail of the appropriate support. So it's important that staff and children and young people are both considering their emotional health and wellbeing. And recognising the support that staff need to ensure that they can effectively then support their children and young people. And the implementation of the plan, therefore, then rightly covers interventions for both children and young people and staff. Okay, so this is the model of support that the framework has recognised is required, and it's in three main areas. The first being wellbeing for all, which includes the whole child, the whole school, and the whole community approach to the promotion of wellbeing. Early support then is the early identification and provision of effective early support before difficulties escalate, and includes the provision of training and capacity building for staff in recognising signs of difficulty and how to respond. And the final part of the model then is enhanced support, which is when a more specialist intervention or service is needed for those children and young people presenting with the more complex needs. So the implementation then of that model and of the framework is to effective integration, working across education settings, the Education Health Authority, health and community services, so that there is a focus for the implementation of the support programs. Okay, so there's a number of supporting programs then that are underpinning that framework that have been developed under the umbrella of the framework that have since it's been launched. Some are up and running and completely operational, others are still being rolled out. So you may see some here and think, oh, why am I not getting those? But it is an implementation plan, as I've said. So the first supporting programme is optimising achievement for school staff and wellbeing. So those programmes are being rolled out with which support school leaders and staff to prioritise their own wellbeing and create a positive school culture that emphasises the importance of staff wellbeing. Coaching services for school principals, and the next cohort of 80 principals has already started, just to give you some sort of figures and let you realise, know that this is actually already ongoing. The resilience programme for school staff, 38 schools have been allocated dates for their professional learning module, and the school leaders, coach schools will have received invitations to register for the programme in September, and the rollout of the programme should have started, and if not, will be starting soon. The Healthy Happy Minds programme then is a therapeutic and counselling services pilot, which provides therapeutic and counselling support for primary school pupils, and funding provided to schools and alongside counselling service schools can also consider a broader range of choices, including play, drama, music, art, equine therapies within a list of approved providers. So that gives schools a bit more flexibility in terms of what they specifically want individually for to meet the needs of their children at that age. The next programme then is the Wellbeing Hub, which brings together existing curriculum-linked resources and support for both pupils and teachers. The existing resources are also being updated, where needed, alongside the development of new resources. So those are all easily accessible then online in one place when it comes to the need for the resources specifically for emotional health and well-being. The Text to Nurse programme then, that's been up and running since the launch of the framework, and it provides a secure, confidential text messaging services for young people aged 11 to 19. This is going to be covered in more detail by Hilary, who's presenting later from the Public Health Authority, so we'll not go into too much detail on that, other than to say it has had quite a number of messages, and those are responded to in terms of our feedback on that within 24 hours. So it's been an excellent service that has been up and running to support directly to pupils. So the next programme then is REACH, which is Resilience in Education, Assisting Change to Happen. And it's a programme for 16 to 19-year-olds, providing universal support through the EA's Youth Service. So it includes a range of things, one-to-one and group work with pupils to support them and develop positive emotional health and increase their readiness for learning and building on their resilience. The programme also designs emotional resilience resources for teachers, and it's based on the 7 key emotions, and they've delivered 25 capacity building workshops to 580 teachers so far, and that was as at September, since the programme started, and it continues to roll out. So the next programme then, supporting programme for the Attach programme and the extended school nursing pilot. So the Attach programme focuses on the impact of trauma on children looked after by providing support to education, health and social care staff and the voluntary sector, who in turn support the child, their family and carers. The extended school nursing pilot, again, another one that Hilary's going to cover, being a PHA focused programme, is the pilot based on ABBY pilot, which is one post-primary in each health trust will receive a school nurse in the school to identify the physical and emotional health needs of the pupils and develop innovative ways to meet these needs. Okay, the RISE programme then, this is the framework is allowing for the expansion of the RISE programme, which again is another health-based programme on the regional integrated support of education, which is a multi-disciplinary early intervention team for Key Stage 2, so basically primary age now, because it's been extended to Key Stage 2. The programme optimises children's access to learning with the educational environment, and support provided includes that for speech and language, communication needs, sensory, motor and perceptual difficulties, and social emotional behaviour skills. And again, Hilary will provide you with a bit more background on that in terms of the health aspects of that. The supporting programme then on emotional health and wellbeing teams in schools, and it's another health-led programme which aims to strengthen the existing provision at post-primary to support schools in promoting their emotional health and wellbeing, build on individual and collective resilience, and most critically provide access to intervention at the earliest opportunity. So those are through the core offer within this programme. Each school will have a named emotional health and wellbeing team practitioner to support them, and who will provide a range of mental health awareness training, which will showcase new interventions and approaches and be supplemented by a suite of resources. Okay, so the Being Well, Doing Well programme then, it aims to provide a framework for schools to assess their current practice and develop a whole school approach to pupil wellbeing through the programme of training and capacity building. It's something like an audit really, where the schools will look at what they have and what they need to become a better emotional wellbeing focused school, if you like. So that is currently being developed and hopefully will be rolled out fairly soon to give that more holistic approach to schools, to let them see what it is they're looking for. So the next steps then, during the current academic year, we'll continue to embed the ongoing programmes and consider how we can effectively integrate and enhance emotional health and wellbeing for both staff and pupils through the whole school approach. In that context, just to reiterate, we have an investment of somewhere in the region of 6.5 million that is purely on this framework shared between ourselves and the Department of Health. So finally then, the assessment of all of this and conscious of the administrative burden on schools that most of you will appreciate you are already under, we want to sort of understand how we can assess the programs of support to provide assurance on what's working, so that funding and support can continue and be focused in the right areas. So I know for the likes of Healthy Happy Minds, schools have been asked to complete questionnaires and things like that. And it is really important that we get that feedback, but also that we try to look at how we get that feedback to make sure it isn't a burden on schools, so that we can get it and get it effectively, so that we can continue to fund where it's necessary and not lose that if we don't have the support, you know, to back up whether this is working or not. So that's my presentation, and I will stop sharing my screen, I hope. And thank you very much for the opportunity to speak to you today, and I hope it's been a helpful overview. And apologies, there's workmen at a house down the road there if there was a bit drilling noise going on. The benefits of working from home. I appreciate there was a lot of information there, but as I say, there is a link that we're going to provide to the framework, and if you have any questions, I think they're being coordinated and we'll respond to them at the end of the session. So thank you very much.
Thank you, Julie. Yeah, there was an awful lot of sound bites getting thrown at us there. I mean, just from an outsider's point of view, and Allstate's very heavy into IDE, the inclusion, diversity and equity. How do you choose the pilots, or how do schools get involved in these things? Do they have to request to you, or do you guys just solicit schools, or what?
There are expressions of interest put out for a number of the programs that are being developed. Some of the programs are rolled out, as I said earlier, to all schools, such as the text to nurse that's available for all, you know, the spread across the trusts to make sure that it's evenly spread in terms of teams and nurses and things like that. Other areas are being rolled out with expressions of interest, and it's basically a case of just developing that to ultimately have a position where every school that wants the support has it. And again, they all interlink the programs, so when an audit is undertaken, that will identify some of the services that they're maybe already getting and some of the services that they could get. So that's sort of another reason for that particular program being developed, you know, so that schools can look at what's there and what can be provided, you know, and talk to the Education Authority and the departments to find out what's there. Things like Healthy Happy Minds, the counselling thing, that's out to all schools. They're given a certain amount of money, and that allows them the flexibility then to determine what counselling services and other as I say, you know, support services like music, art, etc., that they want, that would work best for their school, because at a point schools know best, you know, what will work for their pupils and what their ethos is within that school, etc.
Sure, thank you. I know a couple of years back we had a fantastic presentation from Fresh Minds Education out in Antrim, you know, that went into the schools. Now, as a financial sort of burden, how is there some kind of money available whenever they implement these kind of things? Because there's an overhead, as you said, to all of these. How does that work, sort of thing?
Yeah. Well, as I say, the investment for the Emotional Health and Wellbeing Framework is 6.5 million. Some of that is to go directly into the programs that have been established, and those are established through working with our stakeholders and our professionals to understand what's needed there. But it is a framework that will continue to develop. And as I say, as we assess and understand what's working and what's not working, that will allow us to look at other areas. schools do get their own budget delegated to them, and within the wider curriculum, they have the flexibility to determine what it is they want to buy in externally to provide for their children. Again, in doing that, if it's not one of the bodies that are recognised in the various programmes that are under this framework at the minute, there is advice in the framework itself about buying in external support, and how that should be done, and that they should be sort of it should be evidence-based, and it should be evaluated to ensure that it is going to, work for the school, so these bodies have to have a certain standing, and that what they're actually providing, will be meaningful and useful within the framework for the emotional health and well-being context.
As far as funding and things like that concerned, I mean, is it like a 3-year or 5-year, checkpoints and things like that to see what's working and what's not, and whether it should be dispersed out, or is that Stormont?
Stormont, in terms of the bigger pot, is, as you say, what it is. The monitoring and evaluation of these programs will be done annually, as far as I am aware. And they will continue, as I said, to be developed and moulded based on those assessments. It is, as I said at the start, a high priority area for the Department of Education, and there's a lot of other work that Hilary will talk about beyond this that is also health related and community-based services. So there's a lot of different elements, and part of this framework is to integrate those, as I've said, and have a streamlined service and pathway for children through those various avenues. It's education led purely because it's most likely that things will be picked up in the education setting, but the funding, etc., and the other services, there's so many other services that are outside the framework that will be provided and will continue to be provided.
Yeah, I mean, just one other thing that came to mind just before I asked my colleague about the chat questions. The joined up approach, I mean, it's great if one of the primary schools has engaged in one of these, and unfortunately if they're a feeder into the secondary or grammar schools that don't engage in this, then they sort of lose that. Is that thought about or considered?
It is the purpose of the framework is, and the reason for coming to sessions like this is that this is something that we want schools to be adopting in the same way as they look at their academic sort of status as a school, and the importance of them being an emotional health and well-being school is and should be up there in the same context. So there is a lot being developed around that, and how we will ensure that schools do strive to become emotional health and well-being schools, and that will be, there is a lot of work going into how we will monitor and evaluate to see what schools are and what schools aren't. So it is, like I say, it's a huge program to try and get that in on the ground to all schools, to make sure that they're all doing what they should be doing.
Brilliant. Thank you, Julie.
Julie,
yes,
sorry, Phil, for interrupting you. I have some
yes.
questions here in the chat that people are looking for answers. There is one: are all these programs available in SEN schools? SEN, I'm not sure what that stands for.
That's special educational needs schools, and yes, where it's relevant, they are available. These obviously there's primary, there's post-primary focused, but yes, special schools and education otherwise than at school settings, which the teachers will be aware of as well. They're also available there, and the framework sort of denotes that and makes that clear that these and the basis of the framework covers all.
Okay, another question here is, are they available in nursery schools?
That I am not sure of at this point. As I said, this is where my coming in on Monday hits. From recollection, most of the programs seem to go from age 6 to 19, but not, the programs that I have seen ages on, those are the age limits. There are, as I say, wider programs, Sure Start and things like that, and community services, so they do all interlink. But in terms of that preschool, it is something that I will have to check.
Okay, thank you. Then we have a question. Any indication if HHM funding will continue after Christmas, as it is very much needed and used?
Where we are with Healthy Happy Minds at the minute is, as I said, we are assessing that, and we have secured the funding for the rest of this financial year. We are seeking those questionnaires back from schools to support the need for that to go on in the future, and to consider how that can be integrated within other counselling services that already exist within the wider education framework. So we do, to come back on an earlier point, need that assessment from schools to back up and support the argument for having that in future. And it certainly has been a very positive program, and it is something that, that we would certainly want to support, but we do need that information to be able to do that.
Okay. Have many schools taken up the training so far, and are they just in one area, or?
In certain, we don't have, it's something we're developing in terms of data and statistics to assess how well things are being done, and the sort of the programs that are going to audit where and what schools are availing of at the minute. We do have data on certain areas, including REACH, and it's the youth service one, and it's across all areas of Northern Ireland, and there's been quite a significant uptake. Those youth workers and that have been in most schools in one form or another, because there's a number of programs run within that REACH program.
Okay, thank you. Does anyone else any other questions? No. Okay. Over to you, Phil.
Thank you, Karen. Yeah, so that moves us on now to our next speaker from Public Health Authority, Hilary Johnston. She's going to look after the Mental Health Early Intervention and Prevention Action Plan. And as we've heard earlier from Julie, tell us a bit more about the nurse phone call sort of contact. That sounds quite interesting. And I'm sure it's very useful as well. So Hilary, are you good to go?
Okay, thank you. Can I just check that you can hear me and see my presentation? Okay, perfect. Thank you. Okay, yes, so thank you. So as Phil says, my name's Hilary Johnston and I work for the Public Health Agency. So we are part of the health system, obviously, and we're like an arm's length body of the Department of Health, as a bit of a summary. And we aren't directly responsible for delivery of services, but we are commissioners and kind of about turning policy into commissioning services through trusts, through voluntary community, and through a range of other agencies. So that was just a bit of context as who we are, because I don't assume that everybody would know, and why would they? So I'm going to first of all, give a little bit more information on the two services that Julie has referenced that are very gratefully funded under the Department of Education framework, but that are run through or commissioned through the Public Health Agency. So the first one is the text and nurse service, which Julie mentioned, and I'm hoping that some of the teachers on the call, certainly from post-primary schools, will recognise this poster, which should be out in all schools. So it's a new service from February of last year. It does run elsewhere in the UK, but hadn't been here in Northern Ireland. So the additional funding from DE enabled us to bring it to here, which is great. As was mentioned, it's a confidential service for all children and young people aged between 11 and 19. and they can confidentially text, as it says on the tin, a school nurse, and the numbers are on the poster that should be across all post-primary schools. It guarantees a 24-hour response Monday to Friday and is available during term time and also school holidays. So really the service, it is through the Public Health Agency, Children and Young People's nursing teams, very much in collaboration with the 5 trusts who we actually commission it through, and they are where the school nurses are based. So it uses the text-to-nurse, so digital technology, which is quite new in our world, to offer health-related advice and support. The feedback is very good that young people, children and young people very much appreciate the secure and confidential nature of the service. So anonymous, and it has can support for physical, mental and emotional well-being things, issues that are going on for the children and young people at that moment in time. Julie mentioned that to date there have been, as you can see, over 6,000 messages into the service, which is quite phenomenal for a new service, really, and the uptake was has been pretty consistent from when the service was launched. So there have been almost 9,000 messages out to young people. So you can see that some of those are conversations that go on between a school nurse and a young person for more than one interaction. So a total of that over 777 conversations that are happening. And we thought it was useful to highlight in the context of what we're talking about today, that 47% of those have been related to emotional health and well-being issues or concerns. So we did mention that the young people can text the nurse about any physical or any issue that they're having. And I think sadly it's no surprise probably to any of us that 47% of those calls have been in connection with emotional health and well-being issues. The other school nursing service that again Julie has mentioned is what we call an enhanced school nursing project. And as mentioned, this was based on a pilot that has been a rollout of one pilot in Abbey Community College in Newton Abbey, and the kind of feeder primary schools to Abbey Community College, which had been ongoing for a few years. And very well evidenced and received. So now through the framework, we've received funding to have a similar pilot in each of the 5 trusts. So this is an example, Phil, of one of the ones which at this stage is a pilot, and just one school in each trust area, one post-primary school, but includes the feeder primary schools. Those schools were chosen in collaboration with the Education Authority and the school nursing services, because it's a pilot. It was important that we evidence and review how they work in different types of schools, be it rural, be it urban, be it in a deprived area, and just so we purposely the schools have been chosen to cover a range of types of school. So they've been in place and have started since January of this year. And the idea is that there is one trust-based school nurse physically based in a post-primary school. So this is an example of kind of testing how health and education can work better together to serve the needs of our schools and pupils and teachers. So the school nurse is still employed by the trust and links in with the other trust services, but is based in the school. It provides really excellent collaborative working, and the feedback from both health and education colleagues to date is certainly very positive. The types of things they are doing is working very closely with school principals and school leadership teams and pastoral teams to profile their school health needs. And to help them develop objectives. So it's about looking specifically at what the needs are of that particular school and thinking through solutions to that. They also provide, the school nurse will provide pupil drop-in sessions, which are proving very positive for pupils and teachers. At the minute, they're designing a regional leaflet for sharing and to help spread the word in the schools where this does exist to the young people and to their families. And also as part of the pilot is very much setting up a regional network developed for the school nurses to help the school nurses support each other and learn how they can best support schools and teachers and staff in this new way of their working. Now going to go on to talk briefly about RISE, which again Julie mentioned. So the funding, the additional funding under the framework has enabled the RISE service to be extended into Key Stage 2, which wasn't the case until this additional funding came into place. So that's really great to be able to embed it through the whole of the primary school journey. The current, you can see there the aims, which are about reducing underachieving by optimizing children's access to learning within the school environment or the educational environment, and about fostering health and well-being and social inclusion, which we all know improves the life chances of children. In line with the framework, the RISE service comes at a range of levels. So there's the universal support for teachers and parents, so that's for everyone. There's the more targeted support to address specific needs of children and young people, and to enhance school staff knowledge and skills around that. And then there's a more specialist support, including assessment of children and young people's needs. So at the minute, this funding is now in place, but is quite new. So at the minute, the new teams for Key Stage 2 are focusing on conducting focus groups and engagements with schools and collating the feedback to enable them to review and adapt the programme and the resources available to be appropriate for Key Stage 2, because initially it was just for the younger age group. They're very much linking with primary behavioural support teams to identify joint working opportunities, again, so between health and education. And at the minute, they're also piloting whole class approaches as well as smaller group programs where that is useful. So, and just for anyone who doesn't know, the RISE teams employ a range of professionals, including clinical psychologists, social and emotional behavioural specialists, speech and language therapists, OTs, physios, and therapy assistants. So some of the key initiatives to date have been around OCN Level 2 qualifications for classroom assistants, developing a regional training directory, developing online resources, really working on that integration to be seen and work as part of the school team, developing new models and capacity building for workforce. Some of the positive outcomes have been, it's felt that it really is reaching the more hard to reach children. It's helping with early identification of children in their journey along needing additional support. It's a way of ensuring appropriate onward referrals, making sure the support is in the right place at the right time, improving outcomes, and really that whole joint working between schools, education authority with the health system. So again, quite new in its being on the ground in schools, but feedback is certainly good to date. One of the other programs that I just wanted to mention briefly, it's not under the department, the framework that we've been talking about, but it's something that the Public Health Agency has been involved with supporting in schools in Northern Ireland for a number of years, Roots of Empathy. So it is very much linked with emotional health and well-being. So it's a programme on post-primary skills, and I'm sure some people on the call hopefully may have had experience of it. So it's a programme based around 27 lessons, of one a month, where the school and the family work together to bring a baby, an infant and a parent in from their local community to engage with a year group in a school. So it's helping the children to learn about the growth of the baby and the development of the baby, and encouraging them to think about this and apply it to themselves and others. The theory, the evidence behind the programme is very much, and why I mentioned it today, it's about the evidence shows that once the pupils understand, the baby becomes an enabler for them to understand and recognize their own emotions. It increases empathy, helps to regulate that emotional behavior. So it's just something I wanted to mention. It's supported in about, I think, just over 113 or so primary schools a year. And also wanted to acknowledge the considerable support of the schools who do run the programme, because whilst they get some funding support for that, it is very much the school is central to be able to make the programme run. They develop their own relationships with the instructor, which is the baby and the parent. But it's something that is what we term very early intervention around emotional health and wellbeing support for pupils. For young people. I also want to mention from a public health agency point of view, we do have some training available, which is available to teachers, but to everyone. We have a total population approach usually to a lot of our programs. We are developing to have a regional training framework, and we will be going out in the next year or so to procure a range of mental health programs. They will cover from what we talk about as the range of tiers 1 to 4. Tier 1 is very much about information sharing in terms of mental health, and that could be things like Take 5 as a model. So there could be training around information sharing. Tier 2 is training around awareness raising. Tier 3 skills building, and Tier 4 is the more specialist training. So we have some training available at the minute, but are on a route to procuring more training to be more regionally consistently available. To date, we would say that the tiers of training that will probably be most appropriate for teaching staff and school staff is around Tier 2 and Tier 3. So helping raise awareness around the issues of emotional health and well-being, and also building skills to deal with that lower level of need. There's some things that are already in place. We do have a contract for mental health first aid training, which I know Phil particularly mentioned earlier as something that your organisation does. And to date, there have been some education authority staff trained in that. So mental health first aid is appropriate for 18 plus. It's an adults programme. And we also commission Mindset Adolescence, which is a mental health awareness course, which is delivered through Action Mental Health at the minute, which can be delivered in classrooms. I'm now going to go on to talk just finally a bit about the mental health strategy. So mental health strategy, you can see there is a 10-year strategy. I'm going to say it's new, though we're coming to the end of 2022, but it's a reasonably new strategy, but it is a major driver within health and social care. Around is one of a real key priority and major policy drivers for us. The mental health strategy covers all age groups, so from infancy right through to older people. But obviously in the context of the conversation today, I'm going to focus in a wee bit on some of the things that are obviously particular to children and young people. Maybe just to set the context, and I've taken this directly from the mental health strategy, and Julie mentioned some of these, some of this background earlier on. So according to the Youth Wellbeing and Child and Adolescence Prevalence Study, which many of us may know, among children and young people, 1 in 10, a bit more, experience emotional problems, with significantly higher rates in deprived areas. And that's something as a public health agency that we have a particular focus on. We do know that those who live in deprived areas and are suffering and are living in particular circumstances are more likely to experience mental health and very often physical health issues as well. Also sets out how 1 in 6 young people have a pattern of eating disorder, and almost 1 in 10 of 11 to 19-year-olds reported self-injurious behaviours. And Julie did mention this earlier about anxiety and depression, 25% more common in children and young people in Northern Ireland compared to other parts of the UK. We all know there are huge challenges ahead of us, and that there are a lot of young children and young people and families who need support. There are 35 actions within the strategy. 4 of them particularly relate to children and young people. So these are the 4 about enhanced and accessible specialist services, including for children and young people with disabilities. So that's very much trust-based services. It's about ensuring, it highlights the need to ensure the needs of infants and vulnerable young people are met. And already been mentioned how we know that before young people end up with teachers and in schools, whatever has happened in their infancy will have already had a big impact on their mental health and well-being. It also highlights the need to create regionally consistent, urgent, emergency and crisis services for children and young people. And I think the key word in that is probably regionally consistent. We know waiting lists vary from trust to trust, and that is recognised as a huge issue and something that needs to be sorted. And also mentioned is the continued rollout of specialist perinatal services. One of the, I'm not going to go through all 35 actions, you'll be pleased to hear, just as I put that action number 1 up, but I thought it was very important. So the first action is very much about early intervention and prevention. And based on what came back from consultation on the mental health strategy, it was raised as a high priority around the issue about using public mental health education and effective awareness raising methods to increase public knowledge of the key measures that can be taken to look after mental well-being, to increase understanding of mental ill health, and also very much about encouraging public discourse and dialogue to reducing stigma. I think any of us who have personal experience, family experience, or professional experience know that stigma in this area is an absolutely huge issue. Apologies, my phone has started to ring. That was my time. Okay, so this one is across the life course, but it is something that certainly an engagement that we have been doing with children and young people, they confirm is a high priority for them. They're saying how they're telling us, and we recently had an engagement session with a range of young people, and they were telling us how the whole public awareness, the consistency of the use of language, the supporting people to look after our own mental health and well-being when we can, and before we need help, but also recognizing when we as an individual or a family or friend or somebody does need additional help. So we're hearing back that we all need, we need help in recognizing what is appropriate at different stages. And as I say, the young people highlighted this as a really key issue for them. So one of the things where very much the action plan will focus on is that consistent public messaging across all sectors about what mental health is, what is normal in dealing with everyday ups and downs and things that happen in our lives, recognizing the signs of when we need to look out for and look for further help for ourselves, friends or families. Very much recognition about this isn't just, the health service can't do this, schools can't do this alone. This is a cross society thing, and that we need to look system-wide across Northern Ireland, how we can get the really early intervention and prevention issues better. One of the things, just to mention that the young people did mention, and again, no surprise, I would imagine to any of us, was the impact and the opportunities through social media around the whole public awareness raising. And it's something that, again, they mentioned as a priority. And they told us that they know a lot, as a body of young people, they know a lot about the impact of social media and the safeguarding issues around that, but they know less about they are supported less to know what the impact is on their mental health, on the use of social media, both from a negative point of view and also from a positive point of view. And they were asking us to help as a system to educate them better on that. I'm going to finish up. This is my absolute final slide, and just because of the many of you may know of this already, but I just wanted to mention that there is the NICE guidelines. So NICE is the National Institute for Healthcare Excellence, and they have a role in developing evidence-based guidelines and providing advice for public sector on how to improve outcomes. And they have recently updated their social, emotional and mental well-being in primary and secondary education guidelines around mental health. And they produce this for teachers, school staff, school leadership teams, practitioners in health and social care, for commissioners, for policymakers. So it's a very wide-ranging guideline, but it's very interesting. And everybody's on the call today because they have an interest in emotional health and mental health and well-being. So I think it's a very good document to have as a reference point. And as we can see, it does, it very much talks about the whole school approach. And it's all about culture and ethos and about school policies and how powerful getting those things right in place and supported by health and other partners, that they can have a real impact. And again, Julie mentioned, and certainly when the DE framework was being devised, it did consider what was in the NICE guidelines. So that is me. I'm going to stop sharing my screen. I'm happy to take questions in the hope that I can at least make an attempt to answer them as best I can. And if not, I will certainly follow up.
Thank you very much, Hilary. That was quite a roller coaster of information there. You've definitely earned your cup of tea there. Can I just, before Caroline jumps in with any questions, so the text to nurse, I mean, that's new to me, and that sounds fantastic, wee facility. However, it's only Monday to Friday, 9 to 5. And as we all know, you know, the weekends and evenings are the times that are, is there any chance that that's going to be expanded, or
yeah, I mean,
resources and money, you know,
it's resources and money. Phil, you're entirely right. The thing that it does cover is that although it's 9 to 5, we do guarantee the service does guarantee a 24-hour response. So not ideal, because you know, many people are at their most vulnerable at 10 o'clock at night or whatever it is. But the service does also include, it will give responsive text back to say, if you're in crisis, before we are able to get back to you, this is what you should do. So we'll signpost to wherever. But it's resource. If the resource was there to run it literally 24 hours, that would be great. But it's resource dependent and making best use of resource at the minute. Yeah. And
do you hope to expand? You know, I don't know. I mean, is it a nurse per area, or is it just a load of numbers, or what is it carry? You know, is it you cover these hours, you cover this? How does it work, sort of?
It works. It's the there are 5 trained nurses within each trust area specifically to work in the text and nurse service. So at the minute, I mean, I haven't discussed this with the person whoever sort of commissions and leads out in the service. To do it otherwise would mean employment changes for the specific nurses, if you know what I mean. But I would imagine it will be something that it will be something, I can say more than I imagine, it will be something that's looked at when the service is being evaluated.
Sure, it sounds brilliant. It sounds brilliant. And then I'm going to sort of go, where's the apps? I didn't hear anybody mention apps. I know we have sort of like toyed with apps in-house, you know, mental health first aid apps. Do you sort of advise any of them for the schools, or are you not like that kind of approach? So nobody uses, so like, you know, Mood Matters or English, you know, mental health, they have lots of wee apps and things like that you can have on your phone, and maybe that as a first point of contact is anonymized, you know.
Yeah, I mean, we certainly absolutely were there is a real place for apps in all of our work, particularly in that of children and young people, as you say. So yeah, I mean, any of the websites or resources that we have through PHA or through trusts or through children and young people's strategic partnerships will signpost to those apps that we stand over. So if a young person goes on to the PHA website or the Minding Your Head website or whatever, they will get directed to downloading apps. Yeah, and there certainly is a place for them going forward. And I think it is something that is part of the early intervention plan that I mentioned under the mental health strategy and the whole public messaging. I think it's something that we need to understand better and use better going forward. Yeah.
Like, we're of a generation, it is definitely, you know, the younger ones, if it's on their phone, they're more likely to approach it. However, and being mental health first aider, I was just thinking of that text to nurse. I mean, what's the confidentiality with the school or whatever? You know, is there a feedback if there is, you think there's a need that the school needs to know, or is there nothing like that? No follow-up?
There is a safeguarding mode built into the text and nurse service, where the nurse will have the skills, and there will be a system there where if they feel it's a safeguarding issue, that will be follow-up as appropriate, whether it's with the school, whether it's with whatever service, but yes, it's there.
I'm really glad that you sort of brought forward that reducing stigma, you know, because again, that, you know, that's one of our big thing drivers in work, being able to talk about it. You know, if somebody gets a broken arm and they go to casualty, it's almost like a badge of honor. You know, I broke my arm, but you would never sort of go and say, well, you know, I've had a really bad week or something, you know, I'm not feeling the best. So yeah, reducing that stigma is fantastic. And I know even in the CAMS, I was taking my son to CAMS, and I was in the waiting room, and I would bump into people who you just didn't expect to be there, you know, and it's slightly awkward, you know, but if you were waiting in a GP room or something, you know, you wouldn't take it as anything else. We just say, no, you're here to see the doctor. So
yeah,
look,
I think it is a huge issue, Phil, and I think it's also something that as a system we need to understand better so we can help reduce it, because it needs to happen at all levels. It needs to happen at society level as well as individual level as well, and I think it's something that is very high priority going forward. So yeah, and it's also about the stigma around, the social determinants of mental health. I mean, poverty can be a determinant of a mental health problem, you know, relationship issues, whatever, and they all come with stigma attached to them, or most of them do. So it's looking at how we can destigmatize all of those things. Yeah. So it is definitely high priority going forward.
Sure. Look, Hilary, I'm going to let Caroline take over, because I see there's quite a few questions in the chat queuing up for you. So Caroline, can you?
Yeah.
Thank you.
Okay, there's a question here for, was HHM available in nursery for children and staff?
I think that was still one from me on the Happy Healthy Minds. I was in touch with the team there whilst Hilary was presenting, and I've been advised that no, it's not. It's for schools only. When I say schools only, schools, special schools, and IOTA settings going forward from that age. As to why that is, I don't have the background to that. As I said, there have been a lot of focused early years strategies already in place by the department, so it's likely that those were already captured in that work which preceded the emotional health and wellbeing framework, when that was already being targeted for those early years. So I know there is a lot of programs there, but if there's anything more that I can find out in relation to the nursery support in this, I'll come back to you.
Okay, thank you. Is the text and nurse service free for schools?
It is free for pupils, yes.
Okay. Is the text and nurse service available for pupils only, or can school staff use it?
At the minute, it's available for pupils only, but it is as we speak, being looked at to extend it to school staff and parents. I can't say it definitely will, but it's certainly looking promising that is very likely to be the case in the coming while. Again, it's resource dependent, but I think the value of it is it's actually not the most expensive. While I'm saying it's resource service, it's resource dependent. It's certainly one of the services that is more, not as expensive as other services. So it seemed to be one that it could well be very good value for money to extend it to be available to teachers and parents. So hopefully in the future.
Okay, I have a question here. How can I organise mental health first aid training for teachers in my school?
Okay, I think that would be one, and I hate to defer, and Julie, maybe you can pick up if I'm right on this, but there are some staff in the Education Authority who've been trained as mental health first aid trainers. So I think it would be through whoever your link worker or whatever the term is for any individual school, their link within the Education Authority.
Yeah, and that would be your post-primary or primary behaviour support service in the Education Authority. Okay.
Okay. And one here, thank you for your information. I am a designated teacher for CP and do not think I have heard of the Emotional Health and Wellbeing Framework or many of these programs. How are schools being informed of this support? And is it possible to have names added to a mailing list to ensure that they're kept updated?
The information is provided to the school principals, as far as I'm aware. Certainly the launch of anything like the Emotional Health and Wellbeing Framework, and that's sort of the school's responsibility to ensure that's disseminated down within the school. So as a first point of call, I would suggest that you ask your school principal in relation to any information on the Emotional Health and Wellbeing Framework and what they've been contacted with in terms of programs. There's another question in there, I think, about contact in relation to programs and how that has been rolled out. And as I say, they are it's being rolled out as quickly as possible and within the resources and the constraints that we have. And as I said earlier, a lot of these that are mentioned some are already fully up and running, others are still being rolled out. But the first point of contact is always with the school principal, and it's their sort of call in terms of the school and the school's ethos and what they actually want to engage with and provide for their school and their staff.
Okay. Did all schools get an invite for the Optimising Achievement Staff Wellbeing Programme that again, you mentioned?
That's the sort of the other question I was talking about there. Within that Optimising Achievement and school staff wellbeing, there are a range of programs. There's a coaching service for school principals, and it has been running, and the next cohort of 80 principals have started. The resilience program for school staff. 38 schools have been allocated dates for their professional training learning module. And then the school leader as a coach, the schools, there was a call asking for schools to register again with the programme in September. And the programme for that one on school leader as coach should be starting soon if it hasn't already started. But all of the points of contact are directly to the school. The Department of Education have Schools Plus, where they send all of the information out to all schools, and the Education Authority also then contact when they're working directly. And the contact details, again, the overarching framework will provide a lot of the background to that, and the link to that is in that presentation that I provided earlier. So that would sort of be a first point of call between that the principal and the Education Authority. Depending on whether it's a primary school or a post-primary school, if you make contact with the behaviour support team in each of those areas in the EA, if the school isn't forthcoming in providing it, or if you're not linked to a particular school.
We have a question here. When did the Optimising Achievement Programme first launch?
Again, as far as I'm aware, all of the programs launched in April, following the launch in February 21. Again, within that Optimising Achievement, there are a number of lower level programs, so they're all at different stages. as I've said previously there. So they're running, you know, as quickly as they can to get them up and running, and spreading across the different schools as quickly as we can get them, you know, signed up and running.
Okay, thank you. There was a question about the presentations and the slides that were shown today. We will be sending those out to all those that have responded and attended today. So look out for that email. It will have the presentation and also hopefully a link to the recording from today. Is there any other questions anyone would like to raise? Okay, I'll hand it back to Phil or Paul.
Oh, well, probably, thank you, Caroline. We can give Hilary and Julie a wee break if you don't mind staying on until afterwards, just in case there's any further questions, please. And Paul, we're going to come to you because I'm sure all the participants are waiting to see if see who's going